My name is Debbie Nodine. I'm a dental hygienist at Lockport Dental Group, and I am also the dental hygienist here at Briotes Healthcare Facility. And I am here today to go over oral hygiene with the CNAs, so it can be performed on the residents, the ones that cannot perform their own oral hygiene. So I will start with a lot of residents, as we know, can't brush their own teeth. So that's where you ladies come in to do that job for them. And what I'm looking for is trying to get at least one good brushing like during the day and then a good one at night before they go to bed. Now, if they're in bed, you can brush their teeth in bed, day or night. And what I would do is if they can't rinse, because obviously I know that some of them can't rinse because I do take care of them here, a tiny little bit of toothpaste, just a pea size. I mean, you really only want to use like a pea size on all the residents. And if they do swallow a little toothpaste, it's not going to hurt them. At least they're getting their teeth brushed and they're getting some fluoride on their teeth because the toothpaste does have fluoride in it. And what's happening is that I'm seeing a lot of tooth decay because the plaque is sitting on their teeth all day and for it seems like multiple days. And the plaque is bacteria, which is full of bacteria, and it starts to put holes in the teeth and break them down, so a lot of their teeth are actually broken down to their gum line. So that's the most important, that's one of the reasons we want to brush their teeth on a daily basis. And also another one is the aspiration pneumonia. As food gathers on your teeth and becomes large pieces, which I have removed, if they swallow that and it goes into their lungs, it causes aspiration pneumonia. So that's how they get pneumonia. That's one of the leading things in nursing homes, which I'm sure you guys know that. So that's another good reason. You want to get that food debris out of there on a daily basis. Now, if you absolutely cannot brush their teeth, just document it. I mean, there are some residents that I get that will not allow me to even clean their teeth. So I just document that in my notes, and or have one of the nurses document it for you. I know you do. I'll do documentation here, right? You girls do. Just document that you cannot brush their teeth, because if the the health department could come in and start asking questions and things like that, right, Lisa? Can't that? And at least if it's documented, they can't go back against anybody, because there's some people you just can't make do things, as you know, right? I mean, you've experienced that. So they won't let you brush their teeth, and that's the way it goes. So, oh, and dentures. Okay, there's dentures. Some of the residents have dentures and partials. So what you want to do, if you can, take them out every night. Yeah, I know there's a few of them I've had trouble getting them out when I'm going to clean their teeth, but I don't give up real easily. I try to get them out of there, and I usually can do that. I mean, if they're swinging and saying no, then don't take them out. That's another documentation. You couldn't get out the partials or the dentures. So, but once you do get them out, you want to brush them and then put them in that denture bath all night. Let them soak. If they do have Effordent, that would be great. If not, have them soak in water. Dentures and partials should always be in water. I know there's a few residents that refuse to wear their dentures or partials. So just make sure they're always in a water bath, because they can change their shape. They do dry out, and then say that someday, oh, they want to stick it in, it's not going to fit. But at least it's been in the water, moisten, and it's not going to dry out. And what you want to do in the morning is then take that denture or partial, use hand soap. I did a lot of online stuff, and I looked up how to clean dentures and partials. And actually I tell my patients over at Lockport Dental Group too, just use hand soap because it's not abrasive, and use an extra soft brush. Or the brush, I think the one that they have here that they give them are probably soft. That should be okay. I give out these brushes to my residents when I take care. I don't take care of all the residents here, but a good amount of them. So I always give them an extra soft brush, so they should have this in their room. And you can use hand soap on their partial or denture. Because a partial or denture, they have little pores in them. You can't see them, they're all microscopic, but they do harbor bacteria too, which could cause bad breath and things like that. And then with the swabs, you girls have seen the swabs and stuff, right? So if they got food like up in their vestibule, it's called the vestibule, or up in the roof of their mouth, you can just swab it out with the swab. I think they're lemon swabs or something like that, right? You can just clean that out, because you really want the food debris out of there if you can get it out. Because if they swallow that, because as food sits in their mouth, it just bacteria builds up on that food. I mean, it happens in everybody's mouth. It's like when you brush 3 times a day. If you didn't, you would have a lot of gum disease and decay and just a lot of problems because the bacteria love to feed on food that's in our mouth. It's kind of, I hate to describe this, but our mouth is full of bacteria like our colon. I mean, it sounds gross, but it is the truth, you know? So, what Angela is going to be my demo here. I'm just going to go over brushing. I went over were you here when I said we're talking about the dentures and the partials? Just to take them out every night, make sure they're always in water. Even if the residents don't wear them, you just want to make sure that they're always, because I know there's some that don't, you want to make sure they're always in water because they do dry out and change their shape. And then Effordent is a great thing to soak them in because I know some of the, I don't know, so maybe some of the families bring in Effordent for the residents. That's a good thing to soak them in. And then just brush them with hand soap in the morning. Just use hand soap with their toothbrush. Okay? Because the hand soap is mild. Like some of the toothpaste could maybe scratch the denture, but hand soap is fine to use on them, on the dentures and partials. Let me just see if there's anything else that I wanted to go over. Yeah, and as we age, as the residents age or anyone, we get gum recession, so the root surfaces become exposed. And all the residents here have all these. They have little divots and things in their root surfaces, and that's where the bacteria stick too. So that's why you got to make sure that you can pull, get in there and pull their lips away and get that toothbrush in there. Okay? Any questions while I'm going along here? No? Okay. So Angela is our model today. And what I was saying, if we could at least get them one good brushing in the day and then at night when they're at night, before they go to bed, and you can brush their teeth in bed. And I was saying if they can't spit, just use a pea-sized little bit of toothpaste, just a tiny bit, and it's okay if they swallow it. It's not going to hurt them. But they can sit in bed and rinse, because when I'm cleaning their teeth in the room that I'm in, because they can't get up to go to the sink, I just have them rinse with some water and then spit in this cup. And I just go back to the sink and empty it. So that could even work in bed, but I know you have the kidney shape, like I call it a cuspidor, right, that they can spit in. Okay, and another thing, the denture baths have to be changed every day, which I know you know that. Okay, so we're going to start with Angela here on her teeth. And this is an extra soft brush. And I use Colgate. I know that not everybody has Colgate, but the toothpaste they hear, you could use that, obviously, because it's what you have. But I know a lot of the families will bring in toothpaste for the residents. So what you want to do, okay, chin up. If you can get them to come up a little, I know that some of them you want to be careful because they can't swallow well. So, but just have them bring their chin up a little. And what you want to do is just do a circular motion, and I probably have too much toothpaste down there, which I do. So use less. Kind of a circular motion along the gum line. You want to come up to the front, come to the other side, circular motion. I mean, obviously she's very easy to work on. I know that most of the residents aren't, but what we're just looking for is at least to really give it a real hard try to get in there and clean their teeth. And if you can, stick your tongue out. Brush their tongue too, because tongue harbors a lot of bacteria. Your tongue looks nice and clean. She's got a nice clean tongue. And okay, if they can, have them, try to brush their tongue. I'm not asking you to spend hours on their teeth, but if you could just, once or twice a day, get in there and try to get some of the plaque and the food debris out. And see, but a lot of the residents, because they have a lot of gaps and, I call them nooks and crannies, I mean, food just sticks right in there. If you can, try to floss once a day, but I'm not gonna push that. I just want to see some brushing, more brushing being done. That's what I'm looking for. And then what you do is there you go. And then you can use the toe of the brush here. You can put your tongue. You want to stick your tongue out, don't you? Open big. Open big. And you can use the toe of the brush here and on the inside. And another thing, you always want to get the inside too, in a circular motion. Just kind of go around in a circular motion. And if their gums bleed, don't let that scare you. Just keep brushing. That means you're getting the infection cleaned up around the gum line. That means you've hit the infected area and you're cleaning it, and that's a good thing. And then you just have them rinse again, and there you go. How do they feel? Nice and clean?
Thanks.
You're welcome. And I'll put that, and I'll give that toothbrush to you. That's one of our good, really good toothbrushes. So, are there any questions? Anything at all? Now, how many are you doing it on a daily basis, brushing your residents' teeth?
When they allow it.
Yeah.
That's what I mean. Oh, no, I know. That's why I said if they don't allow it, you gotta document that. You know, just say that they will not allow you to brush their teeth. You know, just say that they're not letting me brush their teeth, or, I mean, that's like, I have some that come to me and they won't let me, like I was saying, they won't let me clean their teeth. And I document that, or if they're, just will not open their mouth, or they're, you know, they get angry at me, I just write that, I just write it right in my notes. And at least I tried, you know. But, and I know everybody tries, and I know you guys are really busy here, because I come in here. I know sometimes you're shorthanded, I do know that, but if you could just really give it an effort on, you know, a daily basis, you know, even if you're in there for 1 minute, that's better than not at all. That's what we're looking for. Because, I mean, when I get a lot of the residents, I know that sometimes they come from when they eat, you know, because I'm here and they get done with breakfast, and you girls, I know you girls are great getting them to me, and but I know when they get the food debris in there, I mean, I get it out, but if you could just, you know, just once or twice a day, that's what we're looking for, and keep their dentures real clean. And if they don't wear their dentures, just keep them in moist, you know, water. We'll keep them moist, okay? Any questions at all? Anything? No? I think is there anything you can think of, Lisa, that I might not have covered? Let me just look at my notes here real quick. I went over all that. Went over the swabs. I guess that's, I covered everything. And plaque is the enemy. Everybody has it in their mouth, and that's what we want to do. That's what you're doing when you brush, is removing bacteria plaque on a daily basis. And like when you brush your own teeth too. And flossing. Because you want to floss between your teeth on a daily basis. I'm not expecting you to do that to the residents. I'm just getting everybody just to brush their teeth to start off. All right? Any questions at all? No? Okay.